therapeutic frequency to a deep level. You send very high frequencies into the body to clash. And when they clash, they die, and the result of them is therapeutic frequency. Okay? So that's inferential current. So, exactly, but the purpose is to get to a deeper level without resistance. But I can't get to the deeper levels with low intensity or a low frequency. I need a low frequency at a deeper level, but the low frequency can't get down there. So you need some other way to get it down there. So if you take the high frequency currents and send them down to collide, that will result in a therapeutic frequency which we can use at the deeper level. That's interferential current. Okay, that's what we're looking at. So greater comfort. Since less intensity will do the job, frequency is, or that's what the F means, frequency is directly proportional to comfort. If you increase the frequency, you'll have more comfort. Also, if you increase the frequency, you'll have more depth of penetration. All right? All right, now, do we have that? All right, I'm going to say it a different way. Adults won't say that they don't know. They just will keep quiet.
I don't know. Just like now.
Just like that. And now I'm not accusing anybody.
I'm talking about me.
I'm just saying. So here's the thing: we want to send a therapeutic frequency into a deep area. A therapeutic frequency cannot, on its own, get down there. High frequencies can go to a deep level, but if we ask it to do anything by itself, it's going to cause fatigue. If we have the high frequencies go in to lose their life, to go into crash, they will produce at the deeper level the therapeutic frequency that's needed for function. That's what we're looking at for interference. Okay. Effective treatment procedure. So, proper electrodes and conductive media. Carbon and wet sponge. No, we're not going to use that. Let's use the carbon rubber. And gel. Let's just do that. Okay. So we're not even going to do the foil back adhesive electrodes. We're not going to do those either. So let's focus on the carbon rubber and the gel. Unsafe to use just water or regular adhesive disposables. Danger of burning secondary to current concentration. So there's a lot of intensity. 5,000. It's not 50 pulses per second. It's a lot coming out. So it's a lot of intensity. So water is going to burn up and eventually it's going to burn your skin. So you want to use gel to send in that intensity. All right, so proper electrode position. Close together for superficial. Still need that one electrode space in between. That's what it calls close together. For muscle, tendon, and ligament. Farther apart for deep or deep joints. Well, the visceral. Where's the visceral?
It's around there.
Visceral. 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 Spine. We're going to work on the spine too. Current flows from negative to positive electrode. Okay, yeah. So the current flows from the negative to the positive electrode. From the negative to the positive electrode. And then there's little Johnny right there. Little Johnny.
The IFC.
Huh?
The IFC, the interferential current.
Yeah.
Is it always focused on the deep muzzle or you can use it with superficial muzzle too?
Well, it still has the same concept. Close, superficial, spread, deep. So it's still going to go. But if we want to make it deep, we need to make sure that we send it in to be beneficial.
So if you're using for acute pain protocol, and you're using this quad polar setup,
Yes.
then you still can use 100 pulse per
if you use it, it won't be effective to go there to really treat deep. That's why most of the time when we get the pain protocols that are deep, it's best to use interferential as opposed to just a straight biphasic machine.
If you want it superficial, then it's okay.
Right, that'll be good for superficial. But if you're trying to get something deep, it'll be best for you to have an interferential unit to get it. Otherwise, it's not going to really go down there effectively. All right, so current flows from negative to positive electrode, equal size electrode, intersects at the middle, resulting vector current. Resulting little Jimmy right there. All right, now, here's what I was talking about earlier. Electrode position. The current flows to the closer to the smaller electrode. This is what I'm talking about. The vector doesn't have to be in the middle. Why? Tell me you have enough information. You really do have enough information. Tell me why that vector is closer to the smaller current.
Because that's where the currents frequencies.
No, that's where they meet. That's
it's
where
much
they
more
cross.
dispersive. Good. Now, if we make these too large, what's going to happen?
No feeling.
You're going to feel it right here. Okay? So it's getting closer to that because it's sensing that this is not been carrying on. You know what I mean? So it's closer because it's a smaller, more active electrode. This is dispersing more of the energy. Okay? So that's why.
So it can't be twice the size, but it can be a little bit bigger.
Yeah, it's a little bit bigger, so you still feel it. Now, once you move to twice the size,
And then you're only going to feel it those 2
yeah, you lose your vector, basically. Okay. All right, now let's keep reading. Underneath the little picture, or the first picture, if you use, we did that on the equal side. We did that. Letter C, proper vector position. The vector is parallel to positive poles if the intensities are equal. I don't know why I said positive, because it could be negative too. So the vector is here. But when it moves back and forth parallel to the positive, could be the negative too, but the positive electrode. When it moves parallel to the positive. If the intensities are the same. Okay. However, number 2, if, number 2, with unequal intensities, the vector is within the higher intensity flow. Why? Did that make sense? So the vector is going to move more, because here's a negative, here's a positive, so here will be channel 1, for example, here will be channel 2. So when it moves, it's going to move more towards this one channel, or move back and forth between this one channel, because this one channel has more energy coming out of it. Otherwise, it would basically stay parallel between the two, and not favor one or the other.
Yes, if the intensities are different.
Different, right. It's going to favor the one of the higher level. Okay. All right, number 3. Vector on, off, or static dynamic controls. All right, we want to look at 3 different things. All right. We want to look at stationary. So if I'm treating an area, let's say that this is the low back, and the person says, hey, right here in the center of my back. Okay? If you want this vector to hit right there in the center of the back, you make sure you have the pads high enough and low enough on both sides so that the vector can fall right there at L4 or L5, for example. Okay? Stationary. Doesn't move. Okay? Or it can be a windshield wiper effect, or a sweep kind of effect, back and forth. All right? Now, how do we get that to happen? On this machine here, we'll look at it later, you can do a moving effect, all right? Or it won't quite be a windshield wiper effect, it will be a, basically a scan type of. So let's say that you had a patient like this here, the shoulder, And up here in the upper traps, they said they had a knot, and sometimes they feel it, and sometimes they didn't feel it, and oh yeah, and then you couldn't reproduce it every time. Okay. Well, you put electrode there, an electrode here, an electrode here, an electrode here, and you know it's in here somewhere, but you can't get it every time. Okay. So what you'll do is there's channel 1, and then there's channel 2. Okay. All right. So you have this vector that's here. Now on the screen over there it says target. And you'll see basically a vector that will sit in the center. And this center right here represents this center on the person's shoulder. Now, I could cause it to scan an area if I press number 1, 2, 3, 4, 5, 6, I think it goes to 7. And you say, well, do you feel it now? Kinda. Well, you can go, let's say, for example, to number 4. If I choose number 4, I can have this vector move out just a little bit and rotate in this whole area. So the stem will move around in this area, and the person will feel the stem move around. You can choose a large sweep, a fast sweep, or a slow sweep. So you can sweep like this here, or you can sweep like this here. And they'll feel the movement of the stem go around. Or I can manually find the area. On that pad over there, it says target on that pad. We'll say over here, because you'll see this on the screen. We'll say over here is the shoulder. This is the head right here. This is the low back. And this is that right hip over this side. And you'll see the little vector on the screen. And you'll put your finger on the screen over there, and you'll move the vector current as a representation underneath their skin. Move it around and say, let me know if I'm really getting a spot. No. Oh, that's the spot right there. Oh, that's the spot right there. Well, if you want the vector to stay, you press start, and then the vector will sit right there at that spot. Now, you could have never found that spot manually with your hand. This is the way you found it underneath the skin. Now, this ain't going to make sense to you, do it. So, make sure you do it. But we can find the vector current with our hand underneath the skin. Okay. God bless you. Okay, let's take a 5-minute break and take this quiz.